I'm Jennifer Zeppelin with Take 5. Well, we are on location today at Thomas Hospital where we're shedding light on a disease that we've heard about but know little about. It's multiple sclerosis. And some of the latest figures estimate that nearly 1 million people in the U.S. are living with MS. So to help us understand this a little more, joining me today is Dr. Elizabeth Minto. She is a neurologist with Infirmary Health. Thank you for being here with me. So share with us, just kind of a quick overview on what MS is.
Thank you so much for the opportunity to raise awareness about MS. It's a disorder of the nervous system where the immune system, for reasons we don't fully understand, attacks the lining that insulates nerve cells and can cause incredibly variable symptoms because the lesions, the inflammatory lesions that MS causes, can happen anywhere in the brain and the spinal cord. And so it's very important that patients understand that they need to have their individual symptoms evaluated, because reading about MS can be very confusing since it can cause such diverse symptoms.
So Elizabeth, share a little bit more about the kind of a surprising statistic that I've kind of stumbled on, is that MS is 3 times more common in women than men. So
that's true. It is a disease that affects women more commonly. We don't fully understand why. It's important to know that the diagnostic criteria and the treatment doesn't change between women and men, but women are more affected. It certainly has something to do with hormones. Most women with MS do feel their symptoms more the week of their period, and there's more symptoms around the time of menopause. As far as why hormones cause this and why women are more affected, we really don't know.
So share some of the symptoms that people might,
So as I mentioned, MS can attack anywhere in the nervous system, and so symptoms can be incredibly different from one person to another, but they can include vision loss, double vision, weakness on one side or the other, difficulty with walking, balance, speech, and even bladder function.
So treatment, is this a treatable disease?
It is a treatable disease. There are people living with MS that you live among that you don't even know have it because the treatments can be so effective. They work better earlier in the disease, and so early and accurate diagnosis is incredibly important. It should include an MRI, and for most patients some lab work and a spinal tap or a lumbar puncture. And so if you have symptoms and you Google them, you may find that MS is one of the causes that comes up. It's so important, because MS is so variable, that you have your symptoms evaluated by your doctor to see if MS is an accurate explanation.
All right, thank you, Dr. Minto, so much for all that great information. We have the website and the phone number on the screen. Have a great day.